guys, what's up? It's Joe. I'm here at Naturopathic Living in Markham with a very special guest of mine. If you've ever felt like you're not getting enough from regular doctors, regular health professionals, a naturopath is a really, really cool option. And to introduce Naturopathic, I want to introduce Dr. Debbie Smrz.
Hi, Joe. Thanks.
Thanks for doing this interview.
Absolutely.
So, for those that don't know you, why don't you give a little bit of background on how you got started in naturopathy and why?
Sure. So I went through school in genetics and molecular biology thinking that I wanted to be a regular doctor. But then the more I looked at the way they are forced in our medical paradigm to treat, maybe 10 minutes if we're lucky, most likely 3, I didn't want to do that assembly line method. And then when I learned about naturopathic medicine, where we actually spend an hour and a half with our first appointments and a minimum of half an hour after that, I thought this makes so much more sense. I can actually get to the cause of what's going on, opposed to just giving you a band-aid solution to get rid of your headache. We can say, well, why? Why do you have a headache? Is it structural? Are you grinding your teeth? Are you eating something that's not working out for you? So we can actually make our patients better.
That's awesome. Now, for those that don't know, what exactly is the naturopath?
So as a naturopath, we're trained to do everything that your regular GP does. So even from gynecological exams to blood draws, we can do all of that, but our approach is different. As I mentioned, we spend a lot more time, and our goal is to get to the root cause.
So, talking about blood, being able to draw blood, she did this really cool treatment where we could see my blood and look at different problems that are happening. What kind of treatments would you say, and services would you guys say you specialize in?
Okay, so we have a lot of different services and treatments that we do here. We're a family clinic, so we treat from little kids right to adults. I do see a lot of weight loss in the clinic, and that's because, well, every disease, cancer patients need to lose weight, heart rate patients need to lose weight, so it's a hallmark of everything, of what we have to do. And along with it is fatigue. So I'd say that one of the biggest things I see in the clinic is fatigue. Patients will come in and just say, you know what, I'm just too tired. I know I need to lose weight, but I can't. And so looking at why. Is it adrenals? Is it thyroid? Is it iron, B12? What are the different reasons that might be the cause of that? And then supporting them in that so that I can send them to you and you can go work out with them.
I can kick their butts. Right. A really cool treatment that you talked about a little earlier was IVs. I want to talk a little bit about why IVs would be important for our health.
Sure. So a lot of times people just aren't absorbing. I mean, you might be taking supplements up the wazoo, but you're not absorbing them. If you have any kind of digestive issues, if IBS, IBD, even anxiety can cause it that you're not absorbing properly. So by doing an IV, we can put the supplements right into the bloodstream. And as an aside, a lot of professional athletes do this now. For example, Argos, after every game, they get an IV right into the bloodstream so that they have no recovery time. And then you were saying about the fighters.
Yeah, when fighters have to cut weight to get IV right away, just to help rehydrate quickly.
Another treatment that I have to mention is biopuncture. I went to Germany to get a lot of my extra training, and so the IVs, the dark field, that we'll talk about the assessment, but biopuncture, I'm seeing phenomenal results in pain management. So this is where we actually inject homeopathic substances into an area, and it helps the body heal itself. I had a patient come in who had gained 65 pounds because she couldn't use her foot. They diagnosed it as plantar fasciitis, but I'm not quite sure if I agree with that diagnosis. So I actually injected right into her foot with some different homeopathic substances. And after the first appointment, she's like, yeah, I think it's a bit better. It was a 12 out of 10, now it's maybe an 8. She came in once more, I did it again. Then she came in the third time, and I'm like, where is it? She started kissing me and hugging me, and she said, it's gone, it's gone. So I said, well, why are you here? And we didn't even treat her that day. She's like, why am I here?
That's
so
awesome.
then we just talked about weight loss, because now she really could come in to see you.
That's awesome. That's awesome. We can talk about assessing too, because if you want to lose weight or if you have a problem, you should always assess. What are some of your assessments that you guys do?
We do a lot of assessments, because I definitely think that we need to know what's actually happening. So, as well as regular blood draws that we do in your medical doctor's office, which we do here, we also do saliva testing. Most hormones, as nice as it is to get it done free at your medical doctor, you're not going to get the same results, because in saliva you're going to test the free hormone. So the free testosterone, the free estrogen, opposed to in the blood where it's testing what's bound. So you're going to actually see what the body is getting, what it's responding to. So saliva testing, urine testing, and then we do a lot of in-house tests as well. So we check your zinc status on your first appointment, urinalysis, and then we have the dark field, the live cell, which I did with you, where we look at your blood under the microscope.
That's really cool. Now, why would all these assessments be important for someone trying to lose weight?
Okay, so well, just to finish about the kind of things with the dark field,
Yeah.
just you can see someone's iron status, their B12 levels, and where on the health continuum they are.
Yeah.
So you can just see, how primed is your body to get disease,
Yeah.
or is your body able to fight anything? It comes your way, you get rid of it in a short period of time, and we can see where on the health spectrum you are.
Yeah, so just for you guys to know, the dark field is when she looked at the blood and we could see everything that was going on, all the red blood cells and everything.
The white blood cells, yeah.
Yeah, really cool.
And you asked about the weight loss.
Yep, with assessments and knowing what you need, what your problem is before you go into weight loss.
Exactly. And I think we talked about the adrenals, the
Right.
thyroid, the B12, the iron, the estrogen, progesterone, testosterone.
Yeah.
The woman, if your testosterone's low, or ladies, if your testosterone's low, as well as having no libido, no sex drive, you're going to be fatigued all the time. And so those two things, I would say that's one of the biggest things I'm seeing right now.
Yeah.
And hair loss.
So, thanks for that. For anyone that would like to contact you, what's the best way to reach you?
Check out our website at natliving.ca, so that's natliving.ca, or call us at 905-604-2491.
Thanks so much for being here.
Thanks so much, Joe.
See you guys.